Okay, I have these symptoms. I'm pretty sure I have PCOS. You, by the end of this video, may even be able to diagnose yourself. And it's so linked to PCOS that it does sometimes help me make that diagnosis for them. Unfortunately, PCOS is not a curable disorder. One of the primary risks of PCOS is infertility. When you're struggling with infertility because of PCOS, we want to help you ovulate. But in general, PCOS is not the crisis of infertility that it once was. Are you someone who's had irregular periods most of your life and you're wondering why? Maybe you've had a lot more hair growth on your chin or on your upper lip than other women you know. Has a friend or a healthcare provider mentioned the acronym PCOS to you? In today's video, we will explore the confusing world of Polycystic Ovarian Syndrome. We'll talk about how to diagnose it. In fact, you, by the end of this video, may even be able to diagnose yourself. We'll also talk about why it's important to know whether you have PCOS, because for a lot of people, it can pose some serious health risks. And by the end of this video, I'm going to teach you how to manage PCOS. My name is Megan Galloway. I am a certified nurse midwife. I have been in the women's health industry since 2012. And throughout that time, I've had a lot of women come into my office with symptoms of PCOS. And when I ask them, has anybody mentioned polycystic ovarian syndrome to you? A lot of them will say, well, yeah, somebody mentioned it, but I've never actually been diagnosed. My hope for you today is that you will learn more about PCOS so that you can seek a healthcare provider who will give you an accurate diagnosis so that you can get the help you need. So let's talk diagnosis. PCOS is a syndrome. So it's called Polycystic Ovarian Syndrome. And most people think that for the diagnosis of PCOS to be made, you actually have to have a lot of cysts on your ovaries. But that's not true for a lot of women. What most women notice who have PCOS is that they have really irregular periods. So a lot of them are not ovulating. And that means that throughout the course of a year, they have very infrequent periods or maybe no periods at all. A lot of women with PCOS also have symptoms of excess androgens, which is like the male hormones, the testosterone type symptoms. So they have excess hair growth, they have cystic acne, things like that. And then some women do actually have a lot of cysts on their ovaries, and they find that out because of an ultrasound evaluation. These three things are what compose the Rotterdam criteria. And this is how we, as healthcare professionals, diagnose you with PCOS. So if you meet 2 out of these 3 criteria, you have PCOS, and it's as simple as that. However, it can be a little bit complicated because say you only have sort of irregular periods and say, yeah, I've got some extra hair on my upper lip, but so does the rest of my family. It's just kind of part of our genetics. Or say you get an ultrasound done and it's not really conclusive about multiple cysts on your ovaries. So it can be kind of a diagnosis that's difficult to make, but ultimately you just have to meet 2 out of 3 criteria to meet the diagnostic criteria for PCOS. One of the things that can help us diagnose you is kind of knowing what your history is. So if you just started having irregular periods, but you've had regular periods throughout your life, you may not have PCOS. There might be something else going on. But if you have a strong family history of lots of women in your family having been diagnosed with PCOS, then it's much more likely that you could have PCOS because it can have a genetic tendency. Okay, so we've gone through the diagnosis. Now, there are a lot of healthcare providers out there who will want to get a lot of labs. They're going to be checking for testosterone levels and a lot of other things. But ultimately, we can diagnose it just based on getting 2 out of 3 criteria met. So you've been diagnosed. You have PCOS. Why does it matter? What are the risks of PCOS? One of the primary risks of PCOS is infertility, because when you're not having regular periods, that typically means you're not ovulating. And if you're not ovulating, you're not going to be able to get pregnant easily. Now, if you want to stay tuned, the end of this video, we're going to talk about how to help you get pregnant if you have PCOS. But let's move on to some other risks. If you do happen to get pregnant with PCOS, some of the risks of pregnancy are increased as well. So there's an increased risk of high blood pressure with pregnancy. There's an increased risk significantly of gestational diabetes with pregnancy. And unfortunately, there can be an increased risk of miscarriage with women who have PCOS. Women with PCOS also often struggle with obesity. And a lot of the reason for that is because women with PCOS usually have something called insulin resistance. And again, at the end of this video, we'll go over a little bit more about how to manage that. But in general, when your body is not able to transport glucose, which is those sugar molecules, into your cells, with insulin, that's what insulin does, then you're going to grow more fat cells. And that causes women to struggle with obesity and struggle to lose weight in general. And then the last thing that I really want you to pay attention to with PCOS is the increased risk of something called endometrial cancer, which is just cancer of the lining of the uterus. When you're not having a period, what happens is for some women, you can actually just build up that lining of the uterus. That's what sheds each month whenever we have a period. So if you're not having a period and it's just building and building and building and building, then that thickened lining of the uterus can build up to a point where those cells can kind of morph and turn into uterine cancer. So if you're not having a period and you're not on birth control, I need you to go talk to a healthcare provider because we want to make sure to protect you from endometrial cancer. Two last things that people often struggle with PCOS: type 2 diabetes, and that's of course because of that insulin resistance, and sleep apnea. Sleep apnea is one of those things that sometimes I ask women about if they have sleep apnea, and it's so linked to PCOS that it does sometimes help me make that diagnosis for them. Let's move on to management. So there are things that you can do at home to manage your own PCOS, and then there are things that we can do as healthcare providers to manage your PCOS. Some of the things that you can do at home are diet and exercise. So the big thing with insulin resistance is that we are going to gain more weight with PCOS for most women, and we're at higher risk of type 2 diabetes and things like that, which we've already discussed. And so if you are keeping track of your diet and exercise and really, really focusing on that, you can actually help manage some of those PCOS symptoms. Unfortunately, PCOS is not a curable disorder. It is something we manage, but it's never something that can be cured. So we have to work really hard throughout our lifespans to help manage those symptoms so that we don't end up increasing our risk of other disorders. I like to suggest that women do a low sugar and low carbohydrate diet that can really manage that insulin resistance. And one of the things that insulin resistance can cause is that irregular periods, that we call it anovulation. That is what leads to infertility for women. So when we talk about things that we as healthcare providers can do to help you, when you're struggling with infertility because of PCOS, we want to help you ovulate. And there's a link between insulin resistance and ovulation. And so one of the simplest things we can do is actually put you on a blood sugar medication, which seems a little weird. It's not, on label for PCOS, but it's called metformin. And it is used for people with type 2 diabetes. Even if you don't have type 2 diabetes, when used in a PCOS setting, it can actually start to regulate periods, which is kind of crazy, right? And so that's one of the things that your healthcare provider might do. One of the other things they might do is if metformin isn't working or if you don't want to go that route, we can actually give you medications that just help you ovulate. There are definitely some risks associated with that, so you want to talk to your healthcare provider about those. But in general, PCOS is not the crisis of infertility that it once was. We have a lot of ways to help women. And it starts with you working on your diet and exercise, which will help you manage your insulin resistance. And it finishes with us in the healthcare world helping you to ovulate. Now, let me be very clear. Those of you who have PCOS, please do not think that you are infertile, okay? I've had so many women who count on that as their birth control method and they're not wanting a baby and then they wind up pregnant. So if you do not want to get pregnant and you have PCOS, please use a backup form of contraception, okay? Now, speaking of contraception, that is one of the things that we use to manage symptoms. And so when we're looking at the risk of things like endometrial cancer, we want to make sure that we keep the lining of your uterus thin. And one of the ways that we can do that is by putting you on some sort of hormonal birth control. IUDs are great for that. Well, the progesterone ones anyways. We can put you on birth control pills. And we don't necessarily need you to ovulate. We don't need you to shed the lining of your uterus or have a period. What we need to do is keep it thin. And the biggest hormone that does that for us is called progesterone. And so if you're out there and you're like, oh man, I haven't had a period in like a year, please go talk to your healthcare provider. They might want to help you at least shed that lining of your uterus so we keep it nice and thin, and then keep you on some sort of hormones, or at least keep monitoring you to make sure that you don't get endometrial cancer. And the last medication that we like to use in this world of PCOS is called spironolactone. And spironolactone is super common. Plenty of dermatologists use it for things like acne. And like I mentioned in the earlier part of this video, acne, cystic acne specifically, and it can be on your face, it can be on your chest, it can be on your back, it can be on your butt cheeks. Cystic acne tends to come along with PCOS. And so spironolactone actually helps to manage those excess androgens, those male sex hormones, specifically mostly testosterone. Spironolactone helps to kind of manage the side effects of the excess androgens, and so it helps with things like cystic acne. It also helps with things like excess hair growth. And in a weird turn of events, it also helps if you're losing hair on your head, it can help you to have a fuller head of hair, which is kind of crazy. It just kind of takes it from here and puts it here, I guess. But either way, it really does work for most women, and it's one of the primary medications that we use for PCOS. So top things that your healthcare provider might want to do for you: talk about diet and exercise. Talk about medications to manage your symptoms. And if you're trying to get pregnant, talk about how to get you to ovulate. And then lastly, they're going to want to protect you from endometrial cancer. So if you're out there and you think, okay, I have these symptoms, I'm pretty sure I have PCOS, go talk to somebody about it, because you definitely want to make sure that you're keeping yourself safe from the possible complications of PCOS. As I said before, unfortunately, PCOS has no cure, but it is manageable. And if you've learned nothing else in this video, it's that you need to take care of your health, and you also need to talk to somebody about managing your symptoms. It's definitely a confusing topic, though, and you might have symptoms that you're not sure if they're PCOS. If you're confused, if you have questions, if you want to tell about your diagnosis or what's helped you manage your symptoms with your diet and exercise changes, please leave comments below. We'd love to hear from you and hear your story, and hopefully help those people out there who are struggling with the same thing you are. And in the meantime, if you want to learn a little bit more about some other fun facts about the female body, check out this video here on the female anatomy. It's really fun, and I think you'll enjoy it. Stay healthy, everybody.